Сегодняшний мой визит направлен на посещение моего лечащего врача, которому я должна буду объяснить ситуацию, сложившуюся на данный момент, потому что после того, когда мы с ним последний раз встречались 10 марта, он меня пока еще не видел. То есть он, конечно же, не знает, не открыл моей истории о том, что я была в госпитале, о том, что со мной случилось. Последний наш визит был... Это было 10 числа, точнее сразу после 10 числа, после моего первого приступа, 10 марта. Те, кто следит за моей ситуацией, они знают всю предысторию событий. Она есть здесь, на этом канале. В каждом файле отдельно представлено все то, что со мной было вплоть до сегодняшнего момента, до сегодняшнего дня. Как я и сказала, эта история, она сейчас имеет начало, но пока не имеет конца. Я не знаю, когда будет конец, и никто не знает. Конец может быть в одном случае. Меня положили на операционный стол, сделали все-таки то, что они должны были сделать, и отпустили меня уже окончательно. Вот тогда можно поставить жирную точку в этом деле. Пока точка еще не поставлена, пока я не знаю, что будет со мной дальше. Вот сейчас я у лечащего, на приеме у гастролога я была, вот, собираю независимые мнения. Что-то общими усилиями, общими путями мы пытаемся найти в интернете. Что-то пишите вы мне, кстати, мои подписчики. Я собираю эту информацию, плюс все себе записываю досконально. У меня уже папка заведена моих этих дел. Я себе ее сделала специально под эту историю болезни. И вот с этой папкой я уже хожу по докторам, показываю, что к чему, как и было, то есть и уже мы решаем, что делать дальше. То есть таким образом вот этот визит, он, конечно же, сейчас очень полезный, он очень важный для меня, потому что, опять-таки, повторюсь, что выписавшись из госпиталя, меня отпустили на такой короткий, неопределенный, но короткий, скажем так, период времени, для того, чтобы я могла как бы одуматься, отрезветь, принять еще раз правильное решение для самой себя, послушать свой организм в течение спокойного времени, вот этого вот, может быть, недели-двух, находясь дома, взять независимое мнение, собственно, вот у гастролога, которому у меня визит на 7 апреля был. Вот сейчас я пришла к моему лечащему еще раз, доктору. И таким образом, собрав вот эти вот независимые мнения не просто обычных людей, да, а уже как бы квалифицированных медработников, докторов, я с этой информацией иду опять в госпиталь спустя 2 недели. У меня уже есть назначение к моему хирургу, к моему лечащему врачу, которые вели меня уже там в госпитале, готовили меня непосредственно к операции. То есть я им обрисовываю то, что я узнала уже плюс еще спустя какое-то время. И мы там, наверное, на общем фоне уже примем какое-то общее решение. Потому что, как я и сказала, эта история, она сейчас имеет начало, но пока не имеет конца. Я не знаю, когда будет конец, и никто не знает. И вот сейчас, то есть получив еще одно независимое мнение, я сейчас опять иду к моему лечащему врачу для того, чтобы на фоне уже всего этого обрисовать еще раз мою ситуацию и прийти к какому-то общему знаменателю. Сейчас, конечно же, когда я к нему попаду, он откроет мою предысторию, у него наверняка уже есть все данные на меня, которые поступили в электронном виде. И на общем таком совете, можно сказать, полусемейном, в его кабинете мы выясним, что же со мной делать дальше. И вот меня уже вызвали, я, собственно, захожу сейчас к доктору. Вот мы заходим, садимся и сейчас начнем свой разговор.
So Jana,
Yeah.
so all the trouble was on the gallstone.
Yes, yeah. You know my results?
Yes. And see what's the latest on that.
Сейчас он пытается мне обрисовать мою ситуацию. Он сказал, что данные на меня уже поступили. Да, я это уже поняла. Итак, слушаем, что же он нам скажет.
You know something about the splitting the gallstones or maybe dissolving?
Yes. What is the latest?
Мы здесь с мужем пытаемся как бы вдвоем что-то дополнять. Мне какие-то мысли приходят, муж что-то дополняет. То есть
successful.
доктор мне говорит, и вот мы тут в 3 головы пытаемся что-то решить относительно меня, относительно моей ситуации.
So Yana, when you were in the hospital, they were trying to recommend that you have an operation
Yes.
to remove the gallbladder.
Yes.
Okay.
But-
And you didn't want to have it done.
Yeah, but lots of question about this operation.
So that's the reason I wanted to talk to you.
Yes,
That's why
yeah,
I called you,
yeah,
so that I can
yeah.
explain all this and see it properly.
Yeah.
And now I'm just going to print something out for you, and then we will go through it together.
Напомню, что на сегодняшний визит переводчика мы не заказывали, мы как бы и сами себе переводчики, скажем так, вот. Но, опять-таки, все то, что здесь будет сейчас сказано, это уже мы идем, скажем так, по второму кругу, обрисовываем мою ситуацию еще раз. Я у него сейчас спрошу некоторые моменты относительно того, что мне делать дальше. Меня интересует также высокое давление. Почему у меня высокое давление? Потому что мое давление обычно это 110 на 120. Вот. Но 110 это мое нормальное давление. И вдруг, когда я попадаю в госпиталь, у меня давление резко скакануло до 170. То есть у меня такого давления никогда не было. Вот сейчас я его прошу, чтобы он замерил это давление мне еще раз здесь. Вот. Доктор, как он и сказал, объясняет это тем, что я, возможно, переволновалась, и в следующий раз, когда я к нему приду, потому что разговор, конечно же, не из простых, и ситуация тоже у нас непростая. Вот, то есть он в следующий раз мне померит до нашего разговора, начнет с этого, с того, что он начнет мне измерять давление и посмотрит, какое оно будет на следующий момент.
This one here is a pancreas. Okay, so what happens is when you have a stone,
Yellow is pancreatitis.
that's a pancreas.
Мгм.
Yeah. So when you have a stone, when the stone goes just in the neck like that, that's probably what happened to you, I think.
Мгм.
Then you get very severe pain because the gallbladder is trying to contract, and nothing is going through because this is blocked. So this is called the neck of the gallbladder. So I suspect that this is what might have happened to you, right? And then once this thing has fallen back in again, then this gallbladder doesn't need to be worried, and it doesn't have that. It doesn't need to contract so much, okay? Or at least the fluid will be easy to go. Now, normally the gallbladder produces a thing called bile, and bile is necessary whenever you eat fatty foods. Anytime you have something which has got fat in it, you need bile to break down the fat. It's like when you have, we need the fat. You need this bile to break down the fat so that the body can absorb the fat.
Мгм.
Right? Now, so this is one thing that can happen. That's number one. Okay. Number two, sometimes it can get blocked. The bile is formed like this. The bile is formed in the liver, and the liver then sends the bile through these two ducts. This is called the cystic duct. It then comes down this way, and then it goes into the gallbladder, and the gallbladder contains the bile. So whenever you eat anything fatty, the gallbladder will contract and push the bile out, so that it can go into the intestine, into the bowel. Right?
Мгм.
Now, sometimes the gallstone can go into this place. This is called a common bile duct. So if it gets blocked here, then the bile cannot flow, and the bile will get dammed back, and people become yellow. You get jaundice.
Really?
You know, have you seen people going yellow?
No.
Have you ever seen someone with yellow? That's what happens. So because the bile cannot escape, it goes into the blood, and people become jaundice because bile is yellow in color, right?
М.
Right. Now, sometimes this one can go like this, it comes down, and then it might get stuck somewhere here. Now, this pancreas produces digestive juice to break down fat, protein, and sugar, right? It does all these things.
So it's easy, yeah.
Protein, sugar, and
Yes, complex sugars, right?
yeah.
Yeah, and protein, sugar, and fat. Right?
Yeah.
So all this, so it produces three kinds of enzymes to help in the digestion. Now, if the stone from here comes down and gets stuck somewhere here, then what happens is the fluid from the pancreas cannot go in here, and it overflows because it's blocked.
The same pipe?
Yes.
So it doesn't have the dedicated pipe to here. It's usually common. They share this.
They share this, correct?
Okay.
Yeah. So this is called the pancreatic duct, and it goes like this, and then it goes into the intestine. This is a small intestine, and this is where all the digestion takes place, right? Now, if it gets stuck here, then this pancreatic juice cannot travel. It gets stuck here, and then it overflows, right? It overflows, and then it's as if the body is digesting itself. So this one goes here, and then you get a condition called acute pancreatitis. Mm-hmm. And if it happens many times, it sort of damages the pancreas. Mm-hmm. So sometimes people suffer from a condition called chronic pancreatitis. That means they keep suffering from pain in the abdomen again and again and again. So that's one. And the second thing is you can have acute pancreatitis. Acute pancreatitis means it's a very severe sort of a pain, and you have to end up in hospital. They put a tube into your stomach to get rid of all these things. So these are some of the complications that can happen when someone has got a gallstone. So what we normally say, there are many people who have got gallstones, right? But many of them, the gallstone is very quiet. It doesn't give rise to any problems. Like my wife has got a gallstone, but it doesn't give any trouble. So we don't do anything. But if she tells me that she's got a problem with the pain and all that, then of course it has to come out, right? So because of these complications, that is the reason the doctors advise that you take out the gallbladder. When there's no pain and there's gallstone, you do nothing. But if you've got a problem, when you've got pain and the stone is giving rise to symptoms, that means it's time for the gallbladder to come out.
Question. So if we have the case like this, which prevent the liquid from the pancreatitis goes there, how removing the gallbladder, cutting here, can solve this problem?
Right. At the moment, we assume that the gallstone is just inside the gallbladder because she hasn't had any pancreatitis.
Yes, acute pancreatitis.
She had pancreatitis.
Yeah, it's that diagnosis. It's acute pancreatitis.
Oh, I see. So that means there must have been a stone here then.
Probably.
Yes. Yeah. So what they want to do, they've given you all these pictures already.
Yeah, like this one.
Oh, very good. They've already explained
and block here.
But no, it's different. That's not the people from the hospital. It's different.
Oh, you've got it.
Yeah.
Okay. So if you've got acute pancreatitis, that means the gallstone must have come here and got stuck here.
It could be here.
Okay, so what has to happen is the doctors have to do a gastroscopy.
Yeah, which doctor said?
The doctor from the hospital.
That's right. So they have to put in a tube from here, like an ultrasound tube. It goes inside here, and they have to check where the stone is and remove the stone.
Only if the stone somewhere here, but if stone somewhere in between, somewhere from some distance from the entrance of here.
Okay.
So,
but because you have
can we get access to and remove that one? If we put somewhere here, not here, but somewhere in the
let's say
far distance.
Okay, let's say it's somewhere here. Is that what you're saying?
Yeah.
If she's got something that's stuck somewhere here, it wouldn't have given rise to pancreatitis. Okay, because this one here is going to block the bile from flowing, and then she'd have got jaundice.
So pancreatitis is only if it comes stone somewhere here.
Yes.
But if this stone somewhere a little bit deeper, so they can get access to them from.
That one I'm not so sure.
How can they can remove during the surgery?
I think what they're going to do is they will have to pass in a gastroscope, a tube, and then they will try and find out where the stone is and pass an instrument into this place and pull it up. So that's what they would do.
But in this case,
Yeah.
why we need to remove the gallbladder?
Okay.
They need to remove the stones from the here, which
Exactly.
cause the problem.
Correct. If you have only got one, if she only had one gallstone, right? What did they say in that thing? I think I have. I've got the report here, so let me see what they say in the report.
Итак, мы сейчас двигаемся дальше. Дальше продолжаем решать ситуацию. Also, we have some my picture like ultrasounds.
That one I don't think I can access that.
Okay. Ну, есть ли у него наглядные картинки того ультразвука, который мне делали там в госпитале?
Here we are. Krishna.
А что доктор написал? Какого размера эти камни? У него же есть заключение?
By the way, my neighbor is a Russian woman.
Really?
Yes.
Wow.
From Vladivostok.
Владивосток. Соседка из Владивостока.
My neighbor.
Cool.
The man is Macedonian. The wife is Russian. But I hear them talking, but I don't know what they're talking. Whether they're talking Russian or whether they're talking Macedonian.
Yeah.
But is the language very similar?
Yeah.
Similar
little
but
bit.
not understandable. We have Macedonian people here. I don't understand them.
You don't.
Yeah.
They have the alphabet.
It's a bit different. I see.
Yeah.
Right.
Cool.
Yeah. Her name is
Same
Alexandra.
roots.
Alexandra, yeah.
And the husband's name is Sasha.
Sasha,
I don't know how his name got Sasha because
Like Alexandra.
that's it.
Yeah.
Sasha, isn't it?
Yeah.
Sasha is short for Alexandra.
Yeah. It's cool.
Okay, so what did they say here? I had the pleasure of being involved, right? Abdominal pain, acute pancreatitis, which is likely caused by gallstones.
Acute pancreatitis.
The episode was fortunately mild, and the symptoms settled within 24 hours. The investigation showed gallstones, so they put plural, more than one gallstone. See the word gallstones? As a likely cause that she's a non-drinker and that normal electrolytes and no recent medication change. The plan was to perform risk-reducing cholecystectomy, so that means they want to remove your gallbladder during this admission. And this was planned for the 3rd of April. However, Yana had significant anxiety and uncertainty about the procedure. We tried a number of times to answer her questions with her son and Russian interpreter, but made little progress. So I think you were a bit nervous about this whole thing, and you didn't want to proceed. So we are going to follow up in the clinic in the next fortnight to discuss and hopefully. So I think from my point of view, I think you should go ahead. So because she got more than one stone, so you have to remove the gallbladder. Otherwise, it's going to give rise to more problem. Wait
a second. You just told us that your wife has lots of the gallstones in the gallbladder.
She got one gallstone.
Just one.
Just one.
Just one. But you don't think about the operation. If you say they remove this one during the surgery and leave the gallbladder in the place, it will solve the problem, or not.
Normally, when people start to have gallstones, the gallbladder is not very functional. It's not. It doesn't work so well. Yeah. So that's one of the things about the gallstone.
Okay.
When you start having gallstones.
But it's a different problem. It's not this one. So, because currently we have the acute pancreatitis, which caused by the gallstones somewhere in this part, somewhere here.
That's correct.
But that's not the problem.
Right.
So that's why he doubt.
But the thing is, if you don't remove the gallbladder, then that stone can give rise to more problems like this again. Yes, it can. Because there's more than one stone. If it's just one single stone sitting there and not doing anything, we say don't worry about it. But because you've had this complication, and we know that you've got this gallstone, then that means it's best that you got to do something.
Yeah, but doctor say it's stones very, very small, not like bigger.
Right.
What's your opinion?
My opinion is, I think you should have the surgery, and I suspect that the fact that you got better, maybe the stone went away. Maybe it's like, you know what is sludge? Sludge is like mud. So sometimes, when you have the gallstone like this, when you got many gallstones there, often the gallbladder also doesn't work very well, and there's a lot of liquid inside there that is like mud. We call it like mud, right? We call it sludge, right? So if the gallbladder is not very functional, and you have the risk that the gallstone can go and do all these other things and give rise to another episode of pancreatitis, why take a chance? That's my opinion.
Так, а что насчет лекарств?
And question, they sent you the discharge paper, right?
Yes, I think this is the letter. Let me see. Dr. Kashalia, that's one. You can keep this one. I'll give you this letter to keep.
Oh, yeah.
You can keep this letter. Center link. I don't think I got the other letter. The discharge hold on. Discharge summary. Referral, but this is a long time ago. This is 2019. This is an old one.
What is relevant to this one?
Not we haven't got it yet.
Just one page?
Just this is the only letter that I got.
So this is just one page?
Yeah, that's
the discharge paper?
It's not quite the discharge paper. The discharge paper hasn't come yet. Because if it comes, then I will have it. If it's still, I should have it. I must have just put this one in here. I think once I started reading this, I put it up there that she got gallstone. But you also had an episode of pancreatitis, right? Acute pancreatitis.
Опять он смотрит в интернете, смотрит мою выписку, что есть. Так. Yeah, and question about these capsules, because I know these capsules.
To dissolve.
Helps for
to dissolve the thing. Okay.
for gallstone. Eurosofilk,
Eurosan, and Eurosebel. Okay. Now I'm going to go to artificial intelligence and see what's the latest on that.
You know something about the splitting the gallstones or maybe dissolving?
Yes. What is the latest on dissolving gallstones and how successful are they? Okay, let me just check on my book. This book is this is 2024. So this is fairly advanced, huh? Fairly new. I buy it every 2 years. All right, so let me have a look at what it says about gallstones. Where's this gallstone? gallstones, 178 to 179.
Косточку, да? Здесь тоже забей.
Okay.
Угу.
This is from Slovenia.
А,
They said that this printing press, they made the first Bible. They printed the first Slovenian Bible in this printing press.
окей,
Yeah.
окей, cool.
Okay, so what are they saying here?
Угу.
Surgery should be considered for patients who have symptomatic cholelithiasis, like you,
Угу.
or gallstones related complications. Examples: cholecystitis, or patients with immune suppression, calcified gallstones, giant gallstones, or family history of gallbladder cancer. Okay, so that's one. Open and mortality and complication rate, right. In well-selected patients, robotic cholecystectomy is an alternative. It's associated with higher cost and has not been shown to be superior. So they say that even if you did it by robotic method, it's not superior to the normal method. Now, conversion to open procedure is based on clinical judgment. 10 to 15% of patients with symptomatic cholecystitiasis, gallstones are detected by intraoperative cholangiogram, and the stone can be removed by laparoscopic exploration of the common bile duct. Delineate bile duct anatomy, etc. Okay. Now, what else are they talking about? Other things. They're talking about other analgesics, antibiotics, surgery, well-selected patients. Okay, so what they're saying here is that 50% of people with gallstones, they present with symptoms or complications, and then they say that if you have an emergency operation, the chances of dying are 3 in 100. 3 in 100, but if it's done as an elective, this is an American book, so they talk about American things, So the mortality, that means people dying from emergency operation, the chances of dying are between 3 to 5%. 3 to 5 when it's done as an emergency. But if it's done as an elective operation, that means they plan the operation and they say come on a certain day and do it, then the chances are 1 in 200. And no, they don't talk about all the other drugs.
А что будет, если... Вот сколько у меня времени?
Medication. Also call it... This is one that you showed me just now. I'm going to give this to you.
Okay.
Yeah. Helps to dissolve the cholesterol-based gallstones. It's most effective for small, non-calcified stones. However, the success rate is between 30 and 50%. So it's only 30 to 50% success rate, whether you can resolve it. Huh? And the process can take months or even years. Percutaneous cholangioscopy. So I don't know whether they can do this kind of thing here or not. This is called percutaneous cholangioscopy. That means they go through the skin and into the gallbladder and remove the stones. So this is what cholangioscopy. And then the other one is extracorporeal shockwave therapy. That means they put you in a bath and they'll send shockwaves into breaking the stones. But they say that this type of stones, they're only effective for certain kind of stones, not for every stone, for certain type of stones. Well, these methods show promise. They are not without limitations, etc. Okay, so we can have a read of that too.
Yeah.
So I think that the thing that most doctors would do these days would be to have an elective operation to remove the gallbladder, and the fact that you are better now and you don't have any pain anymore means this pancreatitis is over. You don't have the pancreatitis anymore because you don't have any symptoms now. The pain is gone.
Yeah, but what if at this point will follow some diet and leave it as it is and no any operations? Are there any problems could be in the future?
Well, I suppose I think it's a good thing. You must try and avoid fatty things because that's what causes the gallbladder to contract and do all that. So you want to avoid anything to do with a lot of fat, right? You lose a lot of weight as well. Okay?
Yeah.
But I don't know enough about whether when you're going on that diet, because you still have to eat a bit of meat and you have to eat a bit of carbohydrate as well. Even though you're going to avoid fat, you still have to eat the other things. And the pancreas is going to produce the enzymes to digest all those things. Yeah.
А может быть, он какие-то мне диеты, вот есть какие-то советы по диетам?
По поводу растворения все-таки, что мы...
Да, по поводу растворения, вот еще раз.
Yeah. What about the dissolving stones?
I think that only is successful in 30 to 50% of patients. 30% to 50% of patients it will be successful.
In dissolving the
in dissolving it.
But maybe we can use this approach to...
But I don't know whether you are entitled to it. Whether it might be...
Maybe you give me some prescription for these capsules.
I'll see whether we can... So what was it called? Ursodeoxycholic acid, yeah?
Где они?
Ursodeoxycholic acid.
But that's our investigation. Maybe you can...
No, I'm sure we have this one. Ursofilk.
That's we found. Yes.
Right.
Not doctors. We just browse the internet.
Ursofilk. Oh, we have it here. Ursofilk. Sorry. Let me see. Previously known as primary biliary cirrhosis. Not for treatment of... Right. So they're saying that you can't get this just for the treatment of stones. You cannot, they won't give it to you for treating stones. You see, not for use in the treatment of, this is another condition, or cholelithiasis. Cholelithiasis means stones in the gallbladder.
She's not for...
So she's not entitled to it. Okay, now the other one is ursocen.
We are talking about the first one right now.
Now we're talking about this.
It doesn't fit.
It doesn't. She doesn't qualify for that. Ursocen.
Next one.
URSOSAN. Ursocen capsule. Let's see what it says. Only for primary biliary cirrhosis, not for use in the treatment of cholelithiasis. So you can't use it for gallstones.
Again, can't use.
Cannot.
Doesn't fit as well.
No. Ursivil. URCEB. URCEBEL. Ursivil capsules. I don't think we have this one here. URCEBL. No, only the first two we had in Australia.
Okay, maybe similar, maybe.
URCEBEL. Okay. Let's go to.
Какие-то другие, может быть, не только же эти существуют, может быть, что-то еще можно попробовать по растворению этих камней. То есть это как бы некая кислота, которая растворяет, это капсулы, это как кислота, которая растворяет вот эти вот камни.
I think they don't have it here. Availability is readily available online. Okay, so they don't seem to know. So the other thing is, I want to know the cost if you would advise privately. Cost of URSOFALK and URSOSAN for on a private script. $295.
It doesn't matter because it's.
Okay. E-medical and $400. And discount pets, another source is at $411. So the cheapest is $295. Depending on the pharmacy where you can get it from. Unfortunately, I couldn't find specific pricing on Ilsosane on the private script. You may want to check with your local pharmacies. Okay, I'm going to print this for you though. Okay, I'll print it out for you.
And you can some give me for a prescription for these capsules.
I have this one. So I'm just wondering what the dose is.
Так он мне prescription выпишет на это?
Он сказал, что не подходит.
What is the dose of?
Не больше 5.
Ну переспроси еще раз.
When you read the description for this, you just told me that you are not in time for this because of some. So that means it doesn't suit the current situation. But when we saw description for this medication just a couple of minutes ago, you said
yes.
It doesn't fit.
It doesn't. Yes, you're right. It doesn't. She doesn't fulfill the criteria for us to be able to get it on the PBS. Where you can use your concession card and get it for $5 or $6. Yeah.
Okay.
Yeah, you can't.
Okay.
And what is the dose of Ursofel?
Не будет, не будет.
Подожди, пускай он выпишет мне, а я посмотрю, я почитаю. Главное, чтобы мне prescription уже
Ты
будет.
читаешь только то, что там написано.
Хорошо.
Ты какой ты читатель, ты что, врач? Ты не будешь говорить?
Нет, пусть, нет, prescription пусть будет. Пусть мне выпишет рецепт, а я посмотрю.
Okay, for gallstone dissolution, it's 10 milligram per kilogram body weight per day in 2 or 3 divided doses. I'll print this out for you.
Thank you.
Oh yeah, thanks. And you give me some prescription for these capsules? Ну вот это то, что мы смогли найти на данный момент. К сожалению, опять-таки, немного данных на меня, но тем не менее.
You know, what's your weight now in kilograms?
Weight 82.
82 kilograms, so
Yeah.
820 mils.
Yeah.
820 milligrams, no? 820 milligrams. And what is the dose of this? That is, it's 500 milligrams. So, you can, so you'll have to take 2 tablets, 2 capsules.
I think these capsules for long period, like not like 7 days or 1 month,
Okay,
like
so
1 year, 5 years, and
something like that.
yeah,
yes.
yeah.
It's going to take a long time.
Yeah, long time, yeah.
All right. Now the other thing is, I'll tell you what you do. Because I've never prescribed this for anybody before, I want to talk to a specialist.
Okay, yeah.
And get some advice from him.
Okay.
As to how much I should give you.
Okay.
And what dose I can give you.
Okay.
Right? Because this one is a capsule.
Yeah, and after call to me back. Okay, yeah,
it's
cool.
a capsule, and you can't. It comes in a tablet form, so you can cut it into half, I suppose.
Yeah, come on to those. Yeah, I know. Yeah, okay. Okay, to
Or you
specialist.
can take
Yeah.
half 3 times a day.
Yeah.
So let me talk to the specialist.
Yeah.
And then I'll get back to you.
Yeah, cool.
Okay?
Cool, excellent. Yeah. Yeah. Туда внутрь положу все это. И по поводу диеты. Вот что он может быть, какую-то распечатку мне дать относительно диеты, что можно, что нельзя, там, или посоветуюсь какого-то диетолога, который мне популярно расскажет, что мне можно, что нельзя, потому что общая фраза «нельзя как бы жареного и жиросодержащего» это одно, а как бы вот спроси по этому поводу.
What is your experience of surgery in Russia? What's it like? What's it like having operations in Russia?
Operation?
Any kind of operations that you,
No.
like your relatives or friends who had operations?
No.
You've never had anything?
No.
Have you heard good things or bad things about that?
It depends, because Russia is quite big. Lots of medical centers.
Let's say Moscow.
Lots of medical centers.
Yes.
They're
Private, is it?
Private
government?
and not private.
Private.
Yeah.
But it could be good, could be bad, because it depends on the people.
Of course. Depends on the surgeon.
Yeah.
Depends
But
on
yes.
the surgeon. Okay. This one's called so take a
Of course, they are high-level specialists, and also the entry-level, so it's different.
Yeah. That's
Depends.
true. Gallstones, acrobatic and
По поводу диеты. По поводу диеты.
Давайте еще вот это у меня пара вопросов.
Хорошо, да. По поводу этого.
Сейчас что у нас смотрит?
Он не может выписать мне так просто эти капсулы. Вот он как раз смотрит это, потому что он не может мне выписать капсулы. Как бы здесь нужно рассчитывать по весу человека, по тому, что происходит как бы у меня там внутри. И на фоне этого всего он скажет. То есть он должен посоветоваться с специалистом.
Еще по поводу давления спроси. Может быть, сейчас давление.
Indian, it's now one problem. When I come in hospital, very high my
blood pressure.
Yeah, like 168, and after 148, 167 again. When I come to gastrolog, he check again 175, again increase. What happened?
Well, that's because you're in pain. When you're in pain, blood pressure will go up.
Really?
Yes.
Can we check it right now?
Yes, the body is reacting to the pain, so that's not surprising. And what was the pulse like? Did they check your heart rate? How fast was it?
It's higher than normal.
It was higher than normal.
Yeah, can you
All
check
right,
it
come
now?
and sit down here. Let me take your blood pressure now.
Oh, okay.
Maybe you're nervous talking about all this.
Вот сейчас я его прошу, чтобы он замерил это давление мне еще раз здесь. И вот что мы видим. Да, но на самом деле давление, конечно же, зашкаливает, пульс тоже как бы не в норме, температура, я чувствую, у меня тоже немного повышена. Вот. Доктор, как он и сказал, объясняет это тем, что я, возможно, переволновалась, и в следующий раз, когда я к нему приду, потому что разговор, конечно же, не из простых, и ситуация тоже у нас непростая. Вот, то есть он в следующий раз мне померит до нашего разговора, начнет с этого, с того, что он начнет мне измерять давление и посмотрит, какое оно будет на следующий момент. Вот сейчас, пока оно высокое,
163/96.
It's too high because my normal 110, 120.
110.
Yeah, yeah.
You have it at home? You have this blood pressure machine at home?
No.
Oh, you don't have one at home. Okay. All right. I think today we've been talking about all this, so I think you might be a little bit nervous. So next time, what we'll do is, before we start talking, we'll do this test.
Okay, okay.
Okay.
And
But it's not. The bottom reading is a little bit high. But for your age, the top reading should be less than 150, and the bottom should be less than 90. So it's a little bit high. It's not terribly high, but it's a little bit high.
need some put some
Like
tablets.
today I had a patient who had blood pressure was 218,
Oh,
218 over 118.
oh my gosh.
See, for her I told her you better come back another day for me to check again,
Okay.
because hers was too high.
Okay.
But this one is not like that.
Okay.
This is high, but not overly high.
Okay.
I'm not going to tell you that you must start a treatment today. Whereas for that lady, I would have,
Okay.
And what about the pulse?
The pulse was 84, so I think that's a little bit high too.
Yeah.
Normally, most people the pulse is below 80. Yeah.
Так, давай еще вопросы какие-то.
A few questions about this one.
Yeah, CP.
If say we go to the operation, I think, how do you think, if additional scanning will require to find out exactly where the stones is located,
Where the stone is.
or it will be opened during the operation, or how do you think? Or
That's probably what they're going to do. They'll probably do it during the operation to know exactly where it is.
So during the operation.
During the operation, they'll probably do the thing.
So before starting the operation, they won't show for 100% where we are located.
Yeah, but that one I can't tell you because
Okay.
these are the surgeons do it in a certain way.
It's question to
Yeah,
surgeon.
so they will be able to tell us more. But overall, I think my own feeling is you have to go ahead with this.
Yeah.
That my feeling is that it's better to go through with this because the taking the tablets and all that, there's no guarantee that it's going to dissolve it.
Yeah, no, no.
Because the chances are.
But maybe.
Maybe, yeah.
Yeah.
But in the meantime, while you're waiting for all this, bad things can happen to you.
Yeah.
You see?
What is this?
ERCP is ERCP. What's the short form for ERCP is
И по поводу диеты еще вопрос. Может он мне распечатать что-то относительно диеты? Посоветовать, может быть, какого-то диетолога или просто вот распечатку какую-то дать? Потому что диета очень важный как бы фактор.
Okay. So what they say is this is called endoscopic retrograde cholangiopancreatography. So that means they put an instrument into your stomach and goes up to here, and then they inject the thing to try and find out where the blockage is. Through the mouth into the small intestine to visualize and treat the tissues in the liver, gallbladder, bile duct, and pancreas. Yeah, and here's a more detailed explanation. Let's see what they say here. Oh, okay. I'll print this out.
Okay, yeah.
No any picture.
No, but there's something here. ERCP procedure.
Okay, yeah.
Yeah.
Okay, cool. You print for me, yeah?
This should be done before the operation or during the operation?
During the operation.
During, okay. То есть в течение операции мне будут делать эту гастроскопию, то есть посмотрят через камеру, что у меня там еще внутри. И по поводу диеты еще.
Also, if you talk about the diet, at this point, what diet should be followed?
Okay, cool. Excellent. Yeah.
Thank you. Lots of information.
When did you come out of hospital?
Friday. This Friday, 11 o'clock.
This Friday. Today
Yeah.
is for 5 days. Now.
Yeah.
Okay. So essentially, you have to avoid fatty things. Okay. All right. So what they're saying is high protein, low fat, right? So lean meat, poultry without skin, fish, beans, lentils, and low fat dairy products. Starchy foods, rice, pasta, bread, and anything that's easily digested. Vegetables and fruit. Focus on low fiber varieties to reduce digestive workload. Clear fluids, broth, gelatin, that means like jelly, and other digestible liquids during the initial recovery phase. So avoid high fat foods, no alcohol, and no sugar or processed foods.
Okay.
No sugar.
So this is what you've got to follow, right?
Да.
And after operation, Yana will be able to eat the more fat products, or this diet
I
should.
think I would follow this for as long as you can, because you've got the gallstones, and the gallstone has to make bile, and the bile is you need that for fat. So you want to try and avoid as fat as you can. Yeah, minimize fat intake.
After operation, even after operation.
Even, yes. No, after the operation of the if the gallbladder is taken out, then I think you can eat what you like. Yeah.
Just like normal life.
I think so. Yeah.
А нужно ли делать после операции еще дополнительные какие-то ультразвуки там и прочее?
And after operation, should we done any scans, maybe some visit to doctors, or
Like double check for...
regularly check this place once a year, 1 or 2 years, or is it not necessary?
I think once it's all been removed, I don't think there's a need to do that. I don't see patients who have had all these things done requesting or getting to have to do this again and again over the next 2-3 years like that. I mean, if people are doubtful and they are not very sure, they would like to be reassured. Sure, we can do it. It's no big thing.
Okay.
It's only an ultrasound. We can just do an ultrasound. Yeah.
Yeah. You last time you give me some prescription with one. If you some pain gone again,
Yes.
need put some tablets like this one or no?
No. Now we know where the pain is coming from. I think. Can you tell the difference between what happened before and what happened after?
Yeah.
You know the difference? You can tell. Okay, then you follow what your body is telling you. Yeah. If you just take one every day, there's no harm. Yeah. You can take one every day for the next 1 month. Just for 1 month. Just take it every day for 1 month.
Once a day?
Once a day.
Once a day, yeah.
Just once a day.
Before meal, after meal?
I think, what does it say here? Does it say anything here? It doesn't say. So you
Okay.
Anytime you like.
Okay. 1 month and stop.
I think 1 month should be alright.
Yeah, okay. Cool.
Yeah.
Okay. Thank you, Indian.
Okay, alright.
Yeah, thank you very much for your help. Yeah.
That's okay.
Because it's very important for me, you know. Yes.
Well, I think I would be.
It's my life, yeah.
Of course.
Okay.
Okay.
Thank you very much.
Okay, all right.
Thank you. Thank you.
Okay.
I think it should be right.
No worries.
Okay. See you next time.
Okay.
Yeah. Ну, вот сейчас я выслушала еще одно мнение. Этот визит был очень полезным. Не, я там потом одену. Okay, yeah, thanks. Мы только что распрощались и вышли из кабинета. Сейчас я иду домой. Опять буду обмозговывать эту ситуацию, буду ее обдумывать. Вот. Ну, опять-таки, судя по тому, как я себя чувствую и вот по моему состоянию, я всегда говорю, что нужно, конечно же, опять-таки прислушиваться к себе. Не знаю, глупо было с моей стороны уезжать из госпиталя и не соглашаться на эту операцию, потому что проблема-то есть, она осталась. И вот он только что подтвердил, мой лечащий, что да, действительно было бы неплохо, если бы вам эту операцию провели и все-таки удалили этот желчный. Почему? Потому что боли и проблемы, они будут возвращаться так или иначе, то есть они никуда не исчезнут сами по себе. Вот, то есть в любом случае с этим рано или поздно нужно что-то будет делать, что-то решать. Вот, и чем быстрее они это сделают в моем более молодом возрасте, тем, конечно же, будет лучше для меня, для моего состояния. Вот, это вот то, что он сказал. Вот, я напомню, что у меня есть еще один визит к моему хирургу и лечащему в госпитале. Я должна буду там появиться в пятницу 11 числа. И вот на фоне всего этого мы уже будем дальше, исходя из ситуации, двигаться в том направлении, все-таки делать эту операцию, не делать, когда ее делать, если делать вообще. И как-то будем уже ставить окончательную точку в этом деле. На этом пока у меня все. Это был еще один такой небольшой видеоотчет, как я и сказала, о моем походе к моему лечащему врачу после выписки из госпиталя. Вот. И увидимся с вами теперь уже в пятницу, 11 числа, на приеме в госпитале. Как всегда, я желаю вам крепкого здоровья, берегите себя, берегите своих близких, не попадайте в такие истории, в которые попала я. И увидимся с вами уже в следующем моем эпизоде. Спасибо всем большое. Всем пока.